off, thank you for inviting me to speak at this event. And I direct the Medical Virtual Reality Lab at the University of Southern California Institute for Creative Technologies. And we started the lab way back in the Stone Age of virtual reality back in 1995 with a focus on clinical applications for using VR and AR. And we moved to other forms of technology as well. But basically, the work that we've done over the years is focused on treating post-traumatic stress disorder, trying to build resilience in advance to prevent PTSD in service members. We've done a lot of work with autism, with virtual human role players for social skill training. Done a good bit of physical and occupational therapy applications with body tracking and game-based apps to try to engage people in very boring, repetitive, and frustrating activities. And then our virtual human work, really focuses on ways that we can foster role playing, whether it's teaching docs to be better docs by practicing with virtual patients, a bunch making their mistakes with virtual patient before they get their hands on a live one, and healthcare support agents, role players, and finally the other areas in cognitive assessment with work we've done with kids with attention deficit disorder, assessing attention in VR, working with people in the beginning stages of Alzheimer's, and so on. So we've had a good run of it so far. Looking forward to the next epic in virtual and augmented reality. We've done a good bit of work with service members where we have attempted to train resilience or teach resilience in advance of a combat deployment by immersing service members in immersive narratives where they're actually, think of it as instead of watching Band of Brothers on TV, you're in the episode and you interact with people on a squad and you go on these 5 to 7 minute missions. So you're part of the team. At the end of each mission, something bad happens. And the bad thing that happens is typically modeled after the kinds of things that we've heard people with PTSD report in therapy. So up to that, I believe belongs to the books. But we don't stop there. I mean, the goal here is to teach people better skills for coping with challenges, not to reduce emotional pain, because these are realistically painful experiences, but how do you cope with these things? So at that point, we have a virtual human mentor that walks into the virtual scene and basically guides the user in the context of the event with different types of coping strategies, everything from basic active breathing exercises to manage food stress to higher level cognitive, reprocessing, cognitive reappraisal, ways of looking at things differently, measuring how much you're responsible for an action versus not, and so on. And by doing this over the course of a series of episodes, we hope, and we haven't tested it out in terms of how do people that are in these events in the real world change or adapt, but we have shown that we hope that they would be better able to cope because they learn something in an experiential way within an immersive narrative. We learn best from story and from experience. So we're hoping that those things carry over. But we have shown with physiological monitoring that the events are emotionally evocative in terms of heart rate variability and so forth. And we found a pretty good uptake with service members actually like it, think it's relevant, and feel they've gotten some benefit. But the next level is really the real world test, if that's possible. It's very challenging in the military and with combat. So basically, with COVID, we're anticipating a similar kind of an urgency to the problem that we faced back in 2003 and 2004 with returning service members. But in this case, it's going to be healthcare providers, nurses, first responders. We already know that those populations have higher suicide rates than the general population, particularly nurses. I was really shocked to see the empirical data on that. So we really want to be for better training, and maybe the urgency of the problem will help us to develop these kinds of scenarios for those groups, but also for the treatment end of things, which I haven't talked about, but that's involved confront and reprocess difficult emotional memories in customized VR experiences that gradually help them to go back and confront the type of trauma they went through. So I'll stop there. Words of wisdom, that's a pretty high bar right now. I think that, part of what resilience involves is acknowledging that you're facing adversity and learning ways to adapt to it. And so, without minimizing any of the suffering that people are going through right now, I think we need to look at, when you can, look at the current experience you're going through as something that you're going to carry with you moving forward in a positive way, learning about how you cope without having, the physical interaction in ways that you can still feel connected with other people, whether it's in an event like this or calling people that you've always been wanting to call after 10 years that you just never had the time to do. Take advantage of these moments and look at it from a perspective of growth rather than limitation. And I think we're going to walk away from this being a little bit richer, maybe a little bit more appreciative of what our regular life, affords us. And well, I guess my second point was going to be really that I think the current crisis has really put an appropriate emphasis on mental health and wellness. And it's driving a deeper awareness and hopefully appreciation that we can use technology. We can leverage technology to enhance those things. Back in again, 2003, 2004, PTSD was, the stuff the Vietnam era vets got, and all that. But the crisis really drove a deeper appreciation of these challenges that I think has filtered now into the civilian sector. So, I think Teddy Roosevelt said, never let a good crisis go to waste. And, maybe we can take advantage of this and without degrading the suffering that people are going through with loss, but we can use this time to help elevate the kinds of things beyond the crisis so we can make a difference in everyday life, not just when there is a crisis. And I think VR, AR, mobile apps, a whole variety of these technology-based things are going to come to the forefront in that regard and be more respected or more valued, or people will have more curiosity about